Hey, good morning. How are you today? It's Dr. Shirley. It's nice to have you with us. I'm glad to be here on this beautiful day in May. I'm here in upstate New York, and part of the work that I do is I'm really a leader in the Get Well Naturally Now. Okay, that's really what this is all about, is to be able to claim our own health, to be able to make small changes, whether with food, whether with environment, whether with, with relationships, and to really live the best life that we really want to live. I'm a firm believer that when our body feels good and our energy is up and we're sleeping solid throughout the night, that we can really do the things that we really want to do. And we really just have this, this one life, I guess, depending on what your belief is. So I think so many people will, I don't know, just maybe not be their best, or maybe hope that life could be better, or hope that they could, do different, whether it's traveling or to start a business or, really to do, any of that, whatsoever. And, I think when we feel better, we're going to do a lot better. So today we're talking about women's health, okay? And women's health is, it's not that it's all that much different, from men's health overall, but it is, it's going to be, we have different organs in our body, but we have different ways that we're going to express ourselves, throughout our body. So let's first of all talk about our lymphatic system, okay? The lymphatic system is a system that runs throughout our body, and it runs parallel to our veins. So the lymphatic system, the best way to describe it is where our cells dump, okay, where the debris goes. So these veins, they run parallel throughout our whole body, and this is where every cell is going to detox on a regular basis. So we're going to take in good food, we're going to take those nutrients, and then we're going to let those detox, okay? Good morning, Angela. Hi, Chuck. Nice to see you both. And so our lymphatic system it's kind of like the garbage, where our garbage dumps on a regular basis. And so based on our health, and we're going to want to, of course, allow that to dump. But what happens is if we don't move that lymphatic system, then it's going to end up getting stuck. We may end up having, trouble around, say our neck area. Remember as a kid to say, oh, we got swollen glands. That's exactly, what that is. Or underneath, lymphedema, different swelling in our armpits, lymphatics, system can be really, really clogged up. And it's a pretty important system, especially when we talk about breast tissue. And we'll talk about that first this morning, because primarily our breasts are made up of a lot of lymphatic tissue, and so people will get sick because they don't move the lymphatic system. Now, how do we do it? It's unlike our heart. Now, our heart is going to pump out the blood, pump out the veins, the blood through there, up and down the oxygen, and this is our whole cardiovascular system, okay? And so with the lymphatic system, it does not work on its own. It does not have a pump, so that's why it can pool. And the only way to move this lymph, okay, this is the, again, the garbage. This is the garbage going out, and the only way to move that is through exercise, through massage, and through skin brushing. So primarily exercise, simple enough. We're just talking walking, gardening, yoga, Zumba, any kind of movement is going to push this debris out. Massage is another way to do that, but most people do not have the luxury of having massage every single day, but massage is going to physically manipulate and move that garbage out of the body. And the other is skin brushing, and skin brushing is something we can do every day. It's really recommended for those that may be infirm. And skin brushing, what a loofah sponge would look like, it's basically just taking that loofah sponge and brushing it towards your extremities, put it into the arms, up to the heart, in through the body, and really that helps to move all of this out. But those of you who exercise, and who exercises out there, give me a like if you do some exercise, because you are the healthiest of all. And by doing any kind of exercise, we're always going to be cleaning. So I like to akin it to, let's say that, you put all your garbage in the garage, right? And then you put more out the next day and the next week and the next week. But if you never call the garbage collectors to come and get all that crap, it's just sitting in there, right? And it's putrefying, and it's, becoming, whether it's smelly or making a bad environment, whatever that is. So we want to be able to move this lymphatic system on a regular basis. My belief is, and again, I like to say, I'm not a medical doctor, I'm a doctor of naturopathy, and I don't treat or diagnose, but my belief is because of the breast tissue, and we'll talk about your bras a little bit, because of this being so tight, our lymph does not move, and you see a lot more breast cancer. Now, there's studies done in other areas of the world, whether that's, in the African, countries, or different parts of South America, where women do not, wear bras. It's just not part of what goes on. And there really is hardly any incidences of breast cancer at all. So there's been some different studies along these lines, especially with an underwire. I remember back about 15 or 20, maybe 15, 20 years ago, they came out with a Wonder Bra. It was like, oh, it was wonderful. Your breasts were lifted up and put in all these different directions, but the compression, is what made it difficult. And so when we wear a bra that is too tight, or, squeezing, or, this underwater kind of thing, what's going to happen is we're going to get a lot less oxygen, to our body, both to our brain and to the breast tissue. So again, if you can picture these lymphatic system kind of being squeezed or being crushed, it's not going to have a way to eliminate, all right? And we need to eliminate. That's what our body does. Take the nutrients and then eliminate. The other thing is the nutrients don't get distributed properly within the breast tissue when things are just too tight there. And then when they're not flushed away, then we're going to have more incidences and difficulties. And one of the main things that doesn't get whisked away is excess estrogen. And we'll talk about that, but most breast cancer, if you do any reading, is related directly to excess estrogen within the breast tissue. Oh, hey, Dr. Roger, how are you? Nice to see you. One of the things that also goes on around the breast tissue is that we in America are really obsessed with, kind of this smell and smelling good and being, just not having, any odor about us. And it's kind of interesting. I did a little bit of a research on this, and back in, even 1800s and 1900s, there really, there wasn't antiperspirant, there wasn't a deodorant, and so this guy, it was actually ingenious, as most marketing is, you put this ad together. This was like, it was 1888. They put this ad together saying, maybe you do smell. Maybe you really do have smelly, underpits. And it made women feel afraid. It made them feel shameful. And that's, when this whole deodorant thing was kind of born. And what's happened over the years is deodorants, they may smell like, mint or, cream puff or whatever else you want to put on your body. But if you look at those ingredients on the back of there, they are all chemicals, okay? All chemicals. And so you've got this area, and then in this country here in North America, we shave our armpits normally. I've been all around the world, and not everyone does this, but you think about that being such a vulnerable area, and then we're taking these sticks of this wax, and especially, we'll talk about, this aluminum, and we're just putting these chemicals on, and they absorb right into our body, and this goes right in, to our breasts. So there are some other studies that show correlation between certain, deodorants and antiperspirants and breast cancer. So really one of the best things that you can do is to cleanse your body out, okay? You will not have body odor if your colon is clean, okay? You will not have, different smells that come out of your body. You will be fresh, and you will feel really good if your colon is clean, if your liver is clean. All of these odors come out of our skin based on, almost the rotting, that's going on inside of our skin, okay? So that's number one. Now, there are people that do have some excessive sweating, but that does not mean that is necessarily, going to be a body odor. And so what they have found, and one of the main ingredients in some of these antiperspirants, is aluminum. You probably know this. And aluminum has actually been shown to block the sweat glands. That's why it works, okay, as a product. But do you want to put aluminum in your body? No, right? We don't want aluminum. We know that aluminum affects our brain. We know that aluminum can affect our thought process and can affect what's called our dendrites, where a thought is going from point A to point B, when you're like, oh, just on the tip of my tongue. And I'm sure too, most of us know people that have been affected by not just dementia, but early onset dementia that might even happen in the 50s or, into the early 60s. And this is just way too early for this to happen. And so we should eliminate aluminum from our diet completely. I'm talking aluminum from, those, I guess, I don't know if people still using those pie pans, right, that for the graham cracker crust, and that's aluminum. Your aluminum foil, this is not a good choice, okay? Aluminum foil is going to have the same kind of effects on your body. So like I like to say, I'm really big on this get well naturally, now movement. But we have to clean things up, and it doesn't mean you go out, right away and do it all at once. But start using some different, whether it's bags. There's a lot of wonderful things in the health foods that you can use to hold on to your fruits and veggies that are not, they do not have the BPA and the plastics in them. They do not have the foils. Okay, so back to the breast health. We've got this underarm. We don't want to do that. There's different options that you can do. Go into a health food store. There's different crystals. I personally have not used deodorant. I don't think ever. I think maybe when I was about 13, 14, and they had that secret stuff, and you're supposed to look like $1 million chick, and smell good too, and not have those embarrassing underarm stains. And again, all of our bodies are different, but you can shift a lot of that and do it naturally. Another thing that goes on with aluminum is it does influence your estrogen, and we're going to talk a lot about that. Most people who have breast cancer have an excess of estrogen in their body. The body becomes estrogen dominant. Now, this happens over time. We're going to talk about about progesterone too. When the progesterone drops, then we become estrogen dominant. The progesterone starts to drop really, in our 40s. And so when we become estrogen dominant, we can have a lot more, susceptibility to certain cancers. Now, we've talked a lot about the certain chemical influences that are also used that are going to raise up our estrogen, and these are chemicals. And you can listen to some of my past shows. Most everything's on YouTube now, but cleaning up your household is going to make a big difference in raising your estrogen levels as well. And we want to keep that definitely in balance. Hey, Lynette, nice to see you. Hi, Diane, how are you? Lauren, nice to see you as well too. So let's talk about parabens a little bit. You can do a little bit of reading. It's Parabens, and parabens are put in a lot of body creams and different makeup, and they've been shown to really spike the estrogen. So by spiking the estrogen again in the body, we have more chances of different breast cancers and cancers overall. As women, you do not see this as much in men, but men are not wearing bras, and they're not having the same issues as we are as women. You may have known about some of the studies that went on about many years ago when they were doing, the estrogen replacement therapy, and those studies had to be stopped because of how many, more heart attacks and how many more strokes were going on because of the HRT, hormone replacement therapy is really what it is. And that's from a chemical standpoint, and it's very different than bioidentical hormones of what we're going to talk about. Now, back in 2012, they did these studies, and 99%, there's 160 samples taken of women that had mastectomies, okay? 99% of them had parabens in them. Okay, 99% of this study, and this is a double-blind, placebo-controlled, the whole real study kind of thing, had parabens in the breast tissue. Okay, so there's a rise in breast cancer. We are one of the highest in breast cancers, in the whole world, and a lot of it is directly related to the hormones, that we have. Okay, so let's talk about a little bit more about what goes on with our progesterone. Okay, I'm going to flip over to that. Progesterone decreases, as I said, as we start to get older. I mean, for myself, I think it was like in my early 40s, and I was in the tub, my hair was long like this, and I looked down, there was just like hair everywhere, long black hair, dark hair. It was just, and I'm going, what the hell's going on? Like, why am I losing, hair? And I really, I didn't know why, but I didn't like it, and so I started doing some research, and a lot of the ways that I've become expert on things over the years, of course, some of my own issues, but I found by becoming an expert in women's health and becoming an expert in bioidentical hormones that it's really enhanced my life, and I love the fact that I can share this with anyone, out there, so you could really understand that some of these things that happen to us do not have to be a direct result of aging, okay? We're going to age no matter what, but how we choose to age. And again, we have choice of most of this, and it's going to be about, in fact, Dr. Roger Boger is on here, and Roger, you remember, Roger coined this phrase that I've used a lot, that you are either A, regenerating right now, or B, you're degenerating. It's one of the two. And you can read about this in my book, Healthy, Lean, and Sexy at Any Age, and I have a section on there on successful aging, and I featured a good friend of mine, Sally Leonard, and I featured Esther Spina, who's an ambitious woman. I featured Dr. Roger as well too. So we get to decide how we're going to age, and this is becomes a choice. Of course, we have our genetics, but it becomes a choice of how we're wanting to live. So let's talk about the progesterone a little bit. So the progesterone is there with and used to hold and conceived egg onto the uterine wall. So we need this when we're younger, okay? So a lot of times infertility is also based on having a lack of progesterone in your body. And this can happen at any age. If you know anyone that has PCOS, which is polycystic ovary, PCOD rather, polycystic ovary disease, a lot of times that can be related to progesterone as well. But definitely as we get into our 40s, and definitely premenopausal. But when you start to think about all the things that happen as we get into these menopause years, and for women that can take between 3 to 4 years. We're going to talk about men's health tomorrow, and andropause, which is like a menopause for men, can take 10 to 12 years. So one of the things that starts to go on is we start to lose our bone density. All right, I am not a proponent, and again, I'm not a medical doctor. You got to figure this out yourself. But a lot of these medicines that are supposed to make our bones stronger actually don't. I mean, there's studies on there's a lot more, breakage and fractures that go on. Progesterone is going to help your body to have a stronger bone. If you don't have enough in it, you're going to start getting a weakness that may result in an osteopenia or an actual osteoporosis, meaning that the bones become porous and brittle and are subject to breakage. The other thing that was really interesting, I don't know if any of you women have noticed that there are these really intense headaches that can happen around our cycle, okay, around our cycle, and we're just starting maybe a couple days before our period, because that's when our progesterone, is the highest. And then let's say there's not a conception, there's no sperm shows up, the egg doesn't need it, so then the whole process of our menstruation starts, and when that happens, our progesterone drops. Okay, so when that drops, we can get these tremendous headaches, and I've had a few over the years. Thank goodness not too many. When I say a few, I've maybe 5 or 6, and even as recently as 2 years ago, I started getting like these crazy headaches again. I'm like, what in the heck? And it literally is progesterone. Now I use bioidentical. Bioidentical means that it's biologically identical to what's going on in your body. It is over the counter, or you can also see anti-aging specialists, which there are many of them. I use one, here in the Rochester area. I'd be happy to give any recommendations. But there's a lot of these popping up all over the place. So bioidentical means it's going to usually rub it in topically. So it's called a transdermal, meaning it transfers directly through the skin into your body. But this can be used, and there's different ways to use it. So again, you want to work with a health professional, but I can certainly guide you in some over-the-counters as well. A lot of women that are having hot flashes directly related to progesterone. Low sex drive is a big one, okay? And that just doesn't feel good. Now, I'm not, an expert. I'm not degreed on sex, but I've had a lot of it throughout the years, and I enjoy a very healthy sex life, and I feel it's really important. But so much of what goes on is, I've had women say like, oh my gosh, I could care less. And it's just their body. It's not their mind. I think we want to be sexual people. I think we want to, have this, loving relationship with the person that we're choosing to be. But if our body is not responding, it doesn't mean that it's our mind. It means that our body just is not producing this progesterone. I mean, I've gone as far as to use progesterone if I know, that I'm going to be, with Mark, or whatever it is. I mean, you can literally use this stuff and feel, quote, in the mood in 10 minutes. I mean, I think it's pretty miraculous, really. It does a lot of wonderful things. Another thing that the progesterone does too is it helps with moods. It's very common when women go through their cycle that they feel weepy and crabby and depressed and all these moods. In fact, you may know Suzanne Summers, and some of you may remember back, when she was in the show Three's Company back in the 70s, so she has become an expert on this. So my advice to you is, if you want to learn about bioidentical hormones, is to get some of her books. Now, they're dated, when I say they might be 10 or 15 years old, but they are amazing. One of them is called The Sexy Years. Gosh, I can't think. I should have written them down. I apologize. But Suzanne Summers, go on Amazon. Find one of her used books, for 2 or 3 books. I'm sure you can download it on Kindle, but you'll really understand the power of not just progesterone, but also your HGH, that's your human growth hormone, which also depletes, and that helps us to lose our body fat. So read those. One of the things that can go on when our moods are low, and I experienced this a couple years ago. I'd really have everything under control for quite a while, and then all of a sudden I'm like, and I'm like feeling sorry for myself, and I just like going through all these emotions. This is just what happened to me one morning, and I'm like, Shirley, what in the hell is wrong with you? This is like so not you, because I wake up every day, really, raring and ready to go, and I'm like, I need more progesterone. So I do this, testing, and I do kinesiology, so I'm able to test that. Oh yeah, I do need, more progesterone. So I literally can rub this stuff on. It's a white cream, transdermal. It's made out of natural yam, and it's all natural stuff. No parabens. There used to be progesterone sold with parabens. Again, you want to get the best out there. And immediately, when I say immediately, again, I'm talking 10 minutes, my mood is lighter. I'm no more like, weepy, creepy, kind of the person that is just not me. So often, women, will feel, down, and it can be a result of that. Another thing that goes on during menopause is a lot of women experience anxiety. Anxiety is just horrible. If you've never had it, fantastic. But there's about 25% of us that are prone to that, whether that's a weak nervous system, whether it's our adrenal burnout, life's events that happen too close together. This can bring us, to the state. And I went through a lot of this, last year, and now, got my body, all balanced again. But severe anxiety results, through different hormonal imbalances that happen during the menopausal years as well, too. So the progesterone will definitely help with that, almost immediately. That, along with some herbs, can really help to calm how that is. Progesterone also helps with insomnia. There's so many people that don't sleep well. And if we don't sleep well through the night, We can be prone to having a lot more weight because our body doesn't, work with the leptin the way that it should. So we gain more weight. Of course, we don't feel good. Our face may age quicker if we're not, sleeping well. So a good night's sleep is sometimes just the answer to almost every health problem, out there. And it also lowers progesterone, lowers your risk of breast cancer. And how does it do this? Because again, that estrogen and progesterone balance that goes on. If we've got too much estrogen, you've got an estrogen dominance, and that's when you're going to be susceptible to breast cancer. As you throw in some progesterone, then you've got a balance going on. But again, you can get these blood tests. In fact, I just called this morning because I think it's been about a year. So I just called this morning and said, oh yeah, I'd just like to have my panels done. I'd like to have my testosterone tested. I'd like to have my HGH tested. And then my estrogen. My estrogen is my estradiol. And they also test what's called free testosterone and free thyroid, because these are normally not tested in your normal medical testing. So I highly suggest you get with a professional. These people can change your life. They just can, as far as balancing your hormones out. We're talking weight loss, energy, almost like a fountain of youth kind of a thing. I believe it really is a fountain of youth for those of us who are I'm going to say over 40 or over 50 or wherever the heck that you may be. So let's I want to go back again about the HRT, hormone replacement therapy. I haven't heard lately. I don't know if a whole lot of women are still doing this, but it used to be a big thing. When I started seeing clients, there was a lot of people that were involved in this, because that was touted to be back in the 50s, the fountain of youth, of taking these like Premarin. Now Premarin is actually pregnant mare urine. That's what it is, Premarin. Okay, do you think that this may not be good for your body? I don't know. But again, they had to stop these studies back, I think it was in 2002. It was a long time ago, but they had to stop the studies because they found that when women did take these hormones, they had an increase in heart disease. They had an increase in cancer, they had an increase in stroke, and then they also had an increase in weight along the way. So is this good? No, it wasn't good at all. And they found out that it actually constricted. It was a vasoconstrictive action that happened, meaning that it took the veins and it made them a lot tighter. So then all the hormones and the natural vitamins, oxygen were just really not able to get throughout the body. So let's talk about a couple more things as far as a vaginal area, for a woman. Again, this is not supposed to smell. We're just being graphic here. I mean, obviously we're supposed to have a natural scent, but a lot of these particular washes, I remember when I was younger, they had some femme spray or whatever. You got to think about what you're putting on your body, okay? You've got to think about this. So if this is some femme spray that's supposed to take the deodorant out of my vaginal area, but it's all full of chemicals, and what a wide open part of our body, right? And we're supposed to spray these chemicals on, and that's supposed to make us smell better? No. A lot of times there's different odors that go on there, and that's because of a yeast or because of a bacterial infection that's happening. So that needs to be taken care of. There's always a source, okay? Again, if we have body odor, there's a source of why that is. If we have vaginal odor, or for man, I'll talk about Men's Health on Monday, and like a jock itch or things along those lines that may create different odors. Our bodies are meant to smell a certain way that is el natural. But I mean, all of a sudden, like you start spraying down there, it smells like pina colada. I don't know. It just seems weird. But we've got to somehow get off the fact that we take all these chemicals, we put them on our body. I mean, putting on creams that are the one that starts with a V, and it's like green and yellow and red and all of these different colors, and all of these dyes are just getting into our body. So we've got to clean ourselves up from the inside out. Now, there's a lot of wonderful, I'm not an expert, I'm in aromatherapy, but there's a lot of wonderful oils that can be used. Coconut oil is also very nice. Coconut oil is antiviral, antimicrobial. You can use that in your vaginal area. It's also nice to use as a lubricant, when you're having sex. And again, if you pick up, like they've got all these different ones in the market. I remember looking at them years ago, and whatever. Again, they smell like cherry and blossom and all of these things. But why would you want to use that? I mean, coconut oil, is a very nice. A lubricant to use. It's easy, and it's healthy too, because we talked about oil pulling very early on, right? And oil pulling, and we found all the benefits of coconut oil and how that helped our organs. Well, if you're putting coconut oil in your body vaginally, it's also going to be very healthy for your body versus having chemicals, dyes, perfumes. These are the things that are going to raise up your estrogen. They're going to put a stress on your liver. They're going to put a stress on your kidney, and then they're going to also, whack your face out, just a little bit as well too. Okay, I'm just going to go back. Okay. because I just wanted to get back on there just a little bit. You can also use just plain old soap and water. Okay, I'm talking about a good soap, a soap that is naturally based. It doesn't have any fragrance. I mean, are they still selling that Coast soap? I remember my dad using that, or Irish Spring or something. Oh my gosh, I was like, I don't know if they still use this, but you should not be using a deodorant soap. Use a natural soap. Use one that's made of coconut. I've friends that sell natural soaps. You can find them online. You can even, I don't know, is Ivory soap still okay? It was supposed to be pure. I just remember as a kid it floated, and I thought that was kind of cool. But just regular soap and water is really fine. And while we're on it, I haven't talked about this too much. Regular soap and water for your hands, not the antibiotic soap, okay? No to the antibiotic soap, and certainly no antibiotic soap down below, okay? You don't want that. That is going to destroy the good bacteria that's in your body. There was a big thing that went on, I don't know, 5-10 years ago that, everyone's got to do their hands. You go to the bank, you go to the restroom, and anywhere you go, they got the stuff that you pump. We were just last summer, Mark and I went on a cruise, and we're not real cruise people, but I'd won this, earned it, through some sales at a nutritional company that I worked for, and it was really interesting. And so we're going into to dinner, right? And the cruise is nice, and whatever. So walking into the dining room, and they're always there to greet you. Oh, hello, good evening, pleasure to see you. And all around the front of the cruise where you walked in, there was 4 stations, and you know what they had? That Purell stuff, okay, the stuff that, whatever's supposed to take, and they directed everyone, this and that. So there's every person that walked through into that dinner, and you're spraying the stuff on their hands, and I don't know if, they didn't quite, of course, not let us in, but I'm like, no, thank you. I'm not going to put that crap on my hands and then go eat, really? But it's so interesting, and all I could think about from a business standpoint was, wow, who got this account? Like on all these, I forget what line we were on. I forget the line, but anyway, they had all these Purell things all over. So this is just, this kind of stuff is prevalent, but you've got to look in it. Don't follow blindly. A lot of what I'm trying to do is just educate from the ground up. Don't follow blindly about putting things on your hair and putting things on your body, because it's all absorbing into your system. I talked a little bit about, we talked a lot about yeast with Candida. If you have systemic yeast, that's a different thing than having vaginal yeast. So I do have a video all about, Candida, which is going to be all through your body, but vaginal yeast is going to, stem. It can be very uncomfortable. It can be very itchy. It can be very hot. It can be very very irritating. And that doesn't mean, there are, some medicines that I know work very well for that, and you kind of scoot that stuff up there. But I personally, had a lot of luck with using colloidal silver. Colloidal silver is antiviral, antimicrobial. It is something, and when my kids had, pink eye when they were little, I put it in their eyes. You can put it in your ear. If you have an ear infection, you can gargle with it. I use this with clients that had diabetic sores. I use it with, parasites. You name it. I'm a big fan. So you could actually, if you're having a yeast infection, you can actually take a tampon and soak it in this colloidal silver and kind of, uppy it up there. And I remember when my daughter's friends, would come over, they would, Mrs. Picardo, I have a yeast infection. And, my daughter would just go over there and they'd soak the tampon. And literally, you start feeling better right away. So we have to understand that our ancestors, whether, you're from an Indian heritage or American Indian heritage or, Italian or Thai or, all of these cultures for years and years and years have had natural remedies. And all of a sudden we somehow call this that, it's new, natural health. No. All these chemicals and all these dyes and additives, that's the stuff, that's new. Let's talk about our bladder just a little bit, and we'll finish up with a couple things. If you have any questions along the way, please pop in. I know I'm going pretty fast here, but that's kind of my clip. Our bladder is a very important area in women's health and in men, but women tend to have more of a weaker bladder than men do. Now, the bladder is the weakest organ in the body. It is the organ that will get, it can actually start to sag. There's actually surgeries that they do this netting to kind of pull, the bladder back up. But the bladder can be made stronger, okay, through a lot of different things. Some of the calcium and magnesium are very helpful for the bladder. And I'll tell you an interesting story. I remember my mom was, I think she was probably about 75 or so, and she was going to the bathroom, urinating during the night, probably 3 to 4 times, which wasn't that odd for someone being 75, 78 years old. And so when I got her on some more calcium, and then I also had her use a urinary product that was called, it was just a parsley combination. It was a calcium and parsley, and this parsley is is meant to strengthen. And what she found was that it didn't take it all the way back down to zero, but instead of getting up 3 to 4 times a week, or night rather, she was just getting up 1 to 2 times. Okay. Oh, and Diane asks, what is the name of my book? Thank you. Yes, the name of my book is Healthy, Lean, and Sexy at Any Age. It became an Amazon bestseller. It is on Amazon. You can find it there. And if you want the Kindle version, it's free. If you want a hard copy, I think it's $10. So, and no, I don't really post notes, but I've got my videos everywhere on my Facebook page, and then most of them, I have a YouTube channel. So if you want to subscribe to my YouTube channel, so you don't have to stay tuned in here every day at 11 o'clock, you'll get a notification every time I have a new class that comes out, and I will continue to do these. So back to the bladder. There was a couple of years ago, gosh, it was more than a couple. I'm trying to think where I lived. It was about 7 or 8 years ago, and it was just after my divorce. I did not have health insurance, okay? And, this happens to a lot of people. My former husband worked at Kodak. I had good insurance for a year, and then after that, it was supposed to be like $700 or $800 a month. I'm like, what are you kidding me? I don't even use a doctor. So I had to roll the dice, and just go without health insurance. And I came down with a bladder infection. Oh, my goodness. You've had them. Most all of us has. The pain, the burning, you can't even believe this. So I put together this remedy, and for me, and again, I didn't have the luxury of going to a doctor for $200 visit. I didn't have any health insurance. Certainly wasn't able to get any antibiotics. So I used Golden Seal, which is a very strong. It's a very strong herb that helps with the immune system. Okay, so I used Golden Seal, and I used garlic. Now, regular garlic is wonderful. You can put it in your ear if you've got an earache. I've used it in my mouth for toothache, all of these things. And I used the Silver Shield I was telling you about. And so my recipe was to do 2 Golden Seal, 2 garlic, and 2 Silver Shield every hour. And I did that, and it took about probably 8 to 10 hours before that bladder infection started, being walked back. I continued on with that to the night and through the next day, and then I let it go just a little bit, but I found I had to stay with it. My point is not necessarily to give you this recipe. My point is that there are natural remedies that are available for most things that you would encounter. And this, I teach a class, it's called a Certified Herbalist class, but I got to tell you, about 80%, maybe 85% of the people that have taken my class, they did so to take care of their family naturally. That was all. I mean, many went on to be, doctors like myself and have health practices and, and all of that, which is a wonderful field to get in. But most people that took my class just want to know, okay, what do I do when my kid's got a headache, or what do I do when my nose is running, and what do I do when I'm sick? And so this is all, in that book. So if you want to look at that, that's on my website, getwellnaturallynow.com. You probably know that cranberry is very good, and cranberry acts like a Teflon in the bladder area. Meaning when the bacteria gets in there, okay, it will not stay. The best thing that you can do for your bladder is to drink water, okay? And because what happens if there's too much bacteria in there, then that's where you're ending up with some of these infections. So important to drink water, but then people think, I got to go in the middle of the night. Strengthen your bladder, okay? Use calcium, magnesium. Parsley is another good one. And again, I use, it's called Urinary Strength, and that's a bladder formula I'm familiar with. If you want to know about that, you can just let me know. But the idea is to prevent all of this. Okay, not to, and with all natural medicine, we want to prevent. It's a lot easier if your bladder is healthy than to deal with an infection afterwards, but, we can indeed, work with that. So we talked about progesterone, we talked about over-the-counter, we talked about, menopause today, too. There are some herbs that are helpful, things like passion flower, black cohosh has been shown to be helpful, your essential fatty acid, all of these, are really, really important with your body. Does anyone have any other questions, anything I can answer for you today? I'm happy to answer any questions. I get a lot of emails. I'm happy to answer, questions. And, really, I'm here to spread the word. I'm here to be a leader within this industry and to make a difference. And Angela says, I highly recommend taking the Certified Herbalist class. There's so much information. Thank you, Angela. Angela's a wonderful student. She's watching the classes. She's taken the course, and I'm sure I would not be surprised if she takes her exam and gets certified as well, too. Well, I appreciate you, and I'm certainly here to help. So keep learning, okay? Keep growing. Go ahead and question what I have to say. I'm not a know-it-all. I know a lot of stuff, but if I say something that's interesting to you, go read about it a little bit, okay? And go learn a little bit more. Ask me questions. Take charge of your health. When you take charge of your health, you're going to have an amazing life, okay? When you feel good, you can do anything. You can work that business. You can go back to school. You can learn something new. You can be, I remember my mom at age 80, she was under the table playing with my kids, like, as a grandma. We get to grow old successfully. We get to choose, to do this. If you've got the right ingredients, so this is just about self-care, but it's our responsibility to do that. I believe that. I feel we have a responsibility to our partners too. I believe Mark has a responsibility to me, and I have a responsibility to him. We are, life partners. We're going to go through the duration, and you know what? I want him healthy. And I'll just end with this. I had this conversation the other day with a good friend of mine, and when I was married to my husband Gary, and we were married a lot of years, and Gary always took his vitamins and took his herbs. He's very proactive, very healthy and all that. And then when I was with Mark just didn't, and I kind of wanted him to be like Gary and just take his vitamins and be proactive. And then I realized that if I put the vitamins out for Mark and put a pile out there, that he took them. I'm like, well, is this worth it for me to do it? Yes, it absolutely is, because I want him sleeping well, and I want him to have good energy, and I want him to sleep good at night, and to have a good sex drive, and to feel good so we can continue to travel the world. So is this worth it to me? Yes, it absolutely is. Diane says, what was the name of the cream? That's it's called Bioidentical Progesterone. I'm sorry, I don't know the name of the brand I'm taking right now. I can get it for you, Diane. Just let me know. I got it at a health food store here in Rochester, and it's a good one. But I will message you. Okay, I will message you afterwards, or I'll put it on here, because maybe some of the rest of you want to know as well too. And then there's different ways to take it, because if you still have your period, you don't take it every day. If you're past having your period, then you do take it every way, and you use just usually about a dime size blurb. Put it on the forearm, and the reason it goes on the forearm is because we don't have a lot of hair there, and it's going to absorb all that much better. So thanks for listening today. Feel free, if you like this, please put a comment down about something that you liked. I'd appreciate that. Send me some hearts. Send me, some good words. I want to get this word out to everyone, because my belief is that we can all get well naturally. And if we can get well naturally now, it's a beautiful thing. So have a wonderful day, and I look forward to seeing you tomorrow. Tomorrow's Men's Health, okay? Not sure what I'm doing the rest of the week, but tomorrow's Men's Health. Oh, wait, I had one more idea. Oh, I'm going to get into some anti-aging this week for sure, too. But I'll put that schedule out. And thank you for all that. Thank you, Chuck. Thank you, Diane. Thank you, Cindy, and everyone who's joined us today. Have yourself a wonderful day. Bye now.